How does FRAX assess fracture risk in postmenopausal women? Imagine a tool that helps doctors predict how likely a woman who has gone through menopause is to break a bone in the next 10 years. That tool is called FRAX. It looks at many factors to give a personalized risk estimate for fractures, especially in women over 65. It considers things like age, weight, height, and whether she has had previous fractures. It also asks about family history of hip fractures, smoking habits, use of steroids, rheumatoid arthritis, secondary causes of osteoporosis, and alcohol intake. These details help create a full picture of her fracture risk beyond just measuring bone density. FRAX can be used even if a woman hasn't had a bone density test, which makes it useful for screening a wider population. But if a bone density test, called a dual-energy X-ray absorptiometry scan, is available, including the results improves the accuracy of the risk estimate. The scan measures bone mineral density at the femoral neck, which is the part of the thigh bone near the hip. Combining this information with clinical risk factors helps doctors decide if treatment is needed. Most guidelines recommend using FRAX for women age 65 and older because fracture risk increases with age and time since menopause. For women between 50 and 64, the scores tend to be lower, and many may not need treatment yet. The tool helps identify women who have a 10-year hip fracture risk of 3% or more, or a major osteoporotic fracture risk of 20% or more, as candidates for intervention. However, FRAX is not perfect. Its accuracy can vary based on race and ethnicity. For example, it may overestimate risk in some Asian and African American women. It also might not perform as well in women under 65, so clinical judgment remains essential. Doctors consider FRAX results alongside other factors to make the best decision for each woman. In practice, FRAX helps identify women who might benefit from further testing or treatment to prevent fractures. It supports personalized care, especially for women living with osteoporosis or at risk of developing it. While it is a valuable tool, it is important to remember that every woman is unique. Always consult healthcare professionals for tailored advice and treatment options. In summary, FRAX assesses fracture risk in postmenopausal women by combining clinical risk factors with or without bone density data to estimate the chance of breaking a bone in the next 10 years. It guides screening and treatment decisions, especially in women aged 65 and older, but should be used alongside clinical judgment to account for individual differences.